Hello, my name is Dr. Robert Barton. I'm with Houston Injury Solutions Network, and my office is Peak Performance Spine and Sports Medicine in Pasadena, Texas. Glad to have you back. In this video, we're going to talk about what's called the Ascension Model of treatment. By this point, you have heard from several of our providers, Dr. Heintz, Dr. Jones, Dr. Smith, and you're getting a lot of information in terms of surgery and talking about injections and decompression and manipulation and all these things. In this video, I want to talk about what's called the Ascension Model of treatment. That means that you always start at the most basic treatment first, and frankly, if that treatment is successful and if that treatment is working, then you don't necessarily need to go to the next level of treatment. So that treatment would be, for instance, maybe ice or self-management of the problem that you're having. And frankly, if you can treat with ice and a little bit of anti-inflammatory for a few days and you feel better, then you might be okay and you don't need to go to the next level of treatment. However, if you're continuing to have to take an anti-inflammatory and you continue to have to put ice on and your back or your neck or whatever body part it is continues to be a problem for a week or two, you probably should be checked out. And then the doctor that you see needs to practice this Ascension Model of treatment, meaning you don't need to jump to a very complicated treatment protocol unless you have imaging that proves that you have a more serious issue until you fail lower levels of care. And that doesn't take a long time. Usually with our chiropractors and our network, we can make progress with people in as little as 2 to 4 visits in most cases, and it gives us information that your problem is going to be an easy problem to fix or maybe a more complicated issue. So it just doesn't take a long time to figure out that a person is moving in the right direction or potentially not moving in the right direction, and at that point imaging is usually necessary. At that point, when imaging proves that you have a more serious problem, now we can start to entertain the more aggressive therapies. Maybe some additional medication, maybe it's injections, maybe we need to go and have a surgical consult. Dr. Jones has been so gracious as to kind of outline the criteria when you need surgery. So that will make sense to you if you're in that particular situation. But you always start at that lower level of care and you give that level of care the opportunity to work, and if it doesn't work, then you escalate up or ascend up. So that is what the Ascension Model of treatment is all about. And we just want to let you know at Houston Injury Solutions Network that that's the model that we operate under, and that's the model that you would be treated under if you ever have the opportunity to come to see us. If you need immediate help, call our phone number. Our operators will direct you to the most convenient location for you, where you live or work. And you can also go to our website, Houston Injury Solutions Network, and there is a zip code locator there, so you would have an opportunity to find the doctor that's closest to you and pick the specialty that makes the most sense to you. So with that, I'm Dr. Robert Barton, and we'll see you next time for Houston Injury Solutions Network. Take care.